Good morning. I'm Linda Reinstein. I'm the co-founder of the Asbestos Disease Awareness Organization, and we want to welcome the staffers to our 17th Congressional Staff Briefing. For those of you who I haven't met before, ADAO is an independent nonprofit dedicated to education, advocacy, and community efforts. We're all about preventing exposure to eliminate all asbestos-caused diseases. So today you're going to hear from a panel of 7 trying to make your life easier with those very full portfolios that you manage for your boss. The order of speakers is listed here. We will be starting with Dr. Frank. The bios are long and terrific. So when you go to the staff resource page, you will see their full bios. For this briefing, it will just be personal introductions. Like ADAO always does, we are dedicating this to Mike Mattmuller. He was a loud voice in Washington. He attended many of our briefings, and Mike lost his life to preventable mesothelioma. Knowing that, give me one second. Today, we want to make your life easier by bringing you the irrefutable information about these 5 touch points, which you might have heard some misinformation or propaganda about. Dr. Frank and Dr. Flores are going to talk about the health effect of asbestos. And of course, we are going to address imports and use. Brent is an expert with legacy in home schools and buildings. Bob, of course, with EPA Part 1 and asbestos reporting. And the need to ban asbestos is clearly something we can all speak about. And Dr. Castleman is an expert about the chlor-alkali industry and efficient uses. Knowing that, we have a lot of information to discuss. ADAO has always built a staffer resource page. We link to the various things that we will discuss this morning, and in hopes to make your life a little bit easier when you write a memo to your boss urging them to support the Alan Reinstein Ban Asbestos Now Act to move this forward. I don't know if Craig is on yet, but Representative Cohen was one of the first politicians, and I think he was at a state level then, that reached out and wanted to help ADAO back in 2004. Many of you worked on reforming TSCA with the Lautenberg Chemical Safety Act. We witnessed a landmark step when President Obama signed it into law. Many of you have been on calls where we talked about the need to prioritize asbestos and how asbestos were the poster child chemical for the need for this reform. I put this slide up so you can see the amount of time we've spent and the work that's been done and what has been discussed and decided from 2016 when it was signed into law to present day, which Bob will talk about, Part 1, Part 2, etc. I think it's really important to take a minute and recognize Senator Merkley, who has been an outrageously fabulous champion for the Alan Reinstein Ban Asbestos Now Act. It is a quick 50-second video, but I think it sums up why do we need to ban asbestos legislatively. Here's
Senator Jeff Merkley here, and I want to talk to you today about a grave threat to our public health, asbestos. We know that exposure to asbestos can be absolutely deadly for individuals. And that's why most of the developed world, some 60 nations in total, have banned it, banned its use, banned its importation, but the United States has failed to act. And that's why Representative Bonamici and I have introduced the Alan Reinstein Ban Asbestos Now Act. We need to get this bill passed. Now, the EPA, they're in a process where they're considering a ban on 1 type of asbestos fiber instead of all 6. That's not good enough. Now is the moment to end importation. Now is the moment to end commercial use. Now is the time to end American exposure to this deadly fiber. Let's get it done and make 2022 the year we pass the Alan Reinstein Ban Asbestos Now Act.
So clearly, Senator Merkley is just rock solid. Let me see how I get this.
Senator Jeff Merkley here, and I want
to move forward. Dr. Frank is going to be talking, the first speaker, talking about asbestos and the fibers. So I'd like to pass the wand off to Dr. Frank. Would you all please just do personal introductions before you start speaking? Dr. Frank.
Thank you, Linda. Good morning, or good afternoon, everyone. My name is Arthur Frank. I'm a physician trained in both internal medicine and occupational medicine. And for more than 50 years now, I've been engaged in work regarding asbestos, having trained at Mount Sinai, which was a major institution for the study of asbestos disease. I've had the privilege of not only working widely throughout the United States, but traveling around the world. I leave again on Saturday to go to India to give lectures about asbestos there, a country that, like the United States, still makes use of asbestos. But over the years, I have worked with ADAO and Linda since 2004, and have been, with my colleagues, active in getting it banned in several countries around the world, including Brazil and Colombia. To be clear, asbestos is a generalized or commercial term that refers to two families of naturally occurring mineral fibers. They're found in nature, they're mined and then put into products. In the past, they've made it into as many as 3 or 4, maybe even 5,000 different products. The most common form is the white asbestos called chrysotile. About 90 to 95% of the world and the United States has used chrysotile. The 6 amphiboles make up, or sorry, the 5 other fibers are 5 amphiboles, 2 of which have been commercially important, amosite and chrysotile. The others show up in other settings. Unfortunately, as useful as these fibers have been, they are deadly and have caused a wide variety of diseases that have been known going back to the 1890s. I mean, this is not a new problem. We've learned that it causes non-malignant disease, the most important one, of course, being asbestosis, or scarring of the lung caused by exposure to asbestos. And in some industrial groups, such as insulators, still can be documented to cause up to 10% of deaths. The real problem and the bigger problem that continues to be with us is the malignancies, the cancers that get caused by asbestos, lung cancer being the most prominent one. The one that's best known and associated with asbestos, of course, is mesothelioma that can occur both in the chest and in the abdomen. There's also laryngeal cancer. In women, ovarian cancer is caused, but there are also gastrointestinal tract cancers and kidney cancers that can be related back to asbestos. Treatment for most of these conditions is not good. Dr. Flores will certainly discuss some of that as someone who treats patients with some of these diseases on a regular basis. But cancer, in large part, especially these cancers, are preventable. And if we no longer make use of asbestos and control what's in place from past use, we can save many, many lives. As you've already heard from Senator Merkley, the EPA is planning only to ban the chrysotile asbestos, but the R-ban bill, the Alan Reinstein Ban Asbestos Act, would ban all fiber types. Plus, it would ban the so-called Libby amphiboles. These are 2 fibers associated with asbestos in Libby, Montana, that have caused hundreds and hundreds of deaths in that community as well. The other issue that at some point needs to be addressed, probably not by either the EPA at this point or even the R-ban bill, is that asbestos shows up in talc and talcum powders. Dozens and dozens of products have been shown to have asbestos in them. That is going to need to be dealt with as well, but we know that mesotheliomas in large numbers have been caused by people simply from using talcum powders with no other exposures. So we have in front of us a preventable disease that some 60 or 70 countries, a product that has been banned. We need to catch up with the rest of the world and stop contributing to the 250,000 worldwide deaths every year from exposure to asbestos, with 30, 40,000 deaths in this country every year. Thank you for the opportunity of sharing some information with you. You're muted, Linda.
Dr. Flores, thank you, Arthur Frank. Dr. Flores?
Hi, my name is Raja Flores. I'm a professor and chairman of the Department of Thoracic Surgery at Mount Sinai School of Medicine. I have been treating mesothelioma cancer patients from asbestos for 30 years now. And the single most devastating case that I see is when we go to the operating room to take these cancers out, and we get in there and we find we can't do anything. And we have to open and close this patient. So we make an incision about this big in them, open and close them. And I got to tell the family, that's it. This patient is dying. There's nothing more that we can do. The scary thing about this is that it's preventable. The reason asbestos is still out there is because there's a lot of misinformation. People frequently think, oh, wow, you mean asbestos is still legal? I mean, there's a reason why ADAO has had 17 of these staffer meetings, because it's not banned in the United States, and it's impossible to get that message out there. And it is very important. Why? Because the solution to these problems are political. They're not medical. When you look at the World Trade Center, which is what we deal with here at Mount Sinai, we are seeing more and more cancers, because now we were 20 years out from 9/11. We are seeing more and more cancers. Just the other week, I resected somebody with mesothelioma from exposure to World Trade Center asbestos. And where did that asbestos come from? It came from Libby, Montana. Much of that where we are doing research with in Libby was sprayed in the World Trade Center. And that went down all over Manhattan and everyone that was working in those areas. And what you realize is that there is still asbestos all around you. So when a fireman goes into a building and he has no idea that there's asbestos in the walls, what is he doing? He's breaking those walls, and that asbestos is coming right on him. So this is critical. Everyone looks to doctors to fix these problems, but this is a political problem. There is a political solution. I cannot save these patients when they come into my operating room and I just have to open and close them. And that is the most devastating thing that you can tell to a family member. When I go downstairs and I tell them, sorry, we open and close, there is screaming, there is crying, there is pain. And then I got to tell that patient in the recovery room that we could not do a single thing for them when this is preventable. So I think what you really have to understand is how much these political decisions affect everyday life. Let's take something like COVID, for example. We just did a study where we showed the period of time where we had to stop elective cases, that the number of lung cancers that were curable shrunk because they were delayed. So because of a decision made by Cuomo in New York State, there was this period of time where we couldn't even operate on lung cancer. Now, am I blaming anybody? No, it's just political decisions need to be made with more knowledge. They can't just be made spur of the moment because you're panicked with the situation. So I think it's very important for us to look at history, look at our past, and realize moving forward, we need to educate the public, educate Congress, and let them know asbestos is not banned. These cancers that you get from asbestos are preventable, but it's not something as a doctor that I'm going to do. It's something that politicians have to do in Congress. I believe in this so strongly that I even ran for mayor of New York City. I was on the ballot as an independent for mayor of New York City, and I still could not get my message out. And that is the main reason why I ran, was to try and get this message out about how political decisions in public housing, exposure to asbestos affects everyday lives. And I don't know what else to do. All I know is Linda keeps pushing this. She's had 17 of these meetings with congressional staffers to try and get that message out, and we still can't, because in Congress, they can save a lot more lives with their pen than I can save with my knife. So please, this is something that can affect a ton of people, and we need to move forward with banning asbestos in the United States.
Dr. Flores, thank you. And to the staffers on this briefing, Dr. Flores's paper is listed on the resource page. Dr. Flores, thank you. Our next speaker is Brent Kynoch. Please introduce yourself, Brent.
Thank you, Linda, and thank you, Dr. Flores and Dr. Frank as well. Hello, all. My name is Brent Kynoch. I'm the Managing Director of the Environmental Information Association, or EIA. EIA is a membership organization that was founded in 1983 as the National Asbestos Council. Our members include the entire vertical spectrum of persons involved in the asbestos abatement industry, and that includes contractors, consultants, laboratories, training providers, regulators, equipment suppliers, owners, and managers. So our organization, more than any other in the country, understands what it takes to identify and remove asbestos from our homes, our schools, offices, and facilities. I'd like to use the next few minutes to share with you my thoughts about a few things. First, legacy asbestos. Second, EPA's authority versus congressional action on asbestos. With that, we'll talk about the Alan Reinstein Ban Asbestos Now Act, which you've already seen something about. And then we'll talk a little bit about a misinformation that's out there about a ban on asbestos. Legacy asbestos. This is a term of art that was coined when EPA started their risk evaluation process for asbestos in December 2016. Legacy asbestos is asbestos-containing material that currently exists in the nation's homes, schools, and buildings. At first, EPA advised that the risk evaluation would not include this legacy asbestos. However, in 2019, the Ninth Circuit Court ruled that EPA must include exposures to legacy asbestos as a part of its evaluation of the risk posed by asbestos. And many of you might think, well, of course, legacy asbestos continues to expose unknowing and unsuspecting people to this deadly fiber. And because we've not banned asbestos, the problem only continues to grow worse. We have clear evidence, for instance, and you'll hear this from our next speaker, that firefighters have a higher incidence of mesothelioma from legacy asbestos exposure than the rest of the population. And as for legacy asbestos that might affect each of you staffers, every House and Senate office building, and indeed the US Capitol building, contains asbestos. Without a ban, the legacy of exposure, disease, and death will continue. Regarding EPA's authority to ban asbestos, the Toxic Substances Control Act, or TSCA, provides a very clear pathway for EPA to ban this material. In 2016, Congress passed provisions to TSCA to give EPA even more teeth and greater power to ban asbestos and other harmful chemicals. But let me be clear, even as far back as 1989, when EPA issued the asbestos ban and phase-out rule, that agency, through TSCA, had the authority to spare our country from a continuation of asbestos exposure, disease, and death. Now, 1989 was 33 years ago, and we could have stopped the manufacturing, importation, and processing of asbestos-containing products, but that ban was overturned. Now, finally, EPA seems to be moving toward a ban on chrysotile asbestos, with the proposed ban released in April of this year. Over 70 nations around the world have banned asbestos. Sadly, the US is not one of these forward-thinking nations. We need to ban asbestos now. That brings me to a discussion of congressional authority to ban asbestos. The Alan Reinstein Ban Asbestos Now Act of 2022, which you've already heard about, is a shining example of that authority and ability of Congress to enact legislation that would ban every fiber and every use of asbestos. Remember, you've heard our medical professionals talk about it, there is no known safe level of exposure to asbestos. So a complete ban, as provided by our ban, is what this nation needs and what its citizens deserve. By banning any further use of asbestos and by requiring a study on the amount of legacy asbestos that currently exists in buildings, our ban will help the US get a handle on a completely preventable asbestos disease like mesothelioma. Some people are suggesting that the definition of asbestos in our ban is not correct and needs to be revised. This is not true. EPA has a definition of asbestos that exists in their AHERA regulation for asbestos in schools, and that definition has existed for over 30 years. It is a tried and true definition. Asbestos hasn't changed in centuries, and there's no need for a definition discussion at this point in time. There are a number of misconceptions about a ban on asbestos that I'd like to address. I've seen a story in the press that suggests an asbestos ban would require abatement of all legacy asbestos that exists in homes, buildings, and facilities today. The article went on to speak of the enormous cost and disruption this would cause and concludes that a ban on asbestos is bad for the United States. Again, this is simply not true. A ban on asbestos would stop imports of this deadly material into the United States. It does not change existing regulations regarding removal and disposal of asbestos. A ban on asbestos keeps us from adding to a continuing legacy of asbestos exposure. The chlor-alkali industry is waging a well-funded public relations campaign that would have us believe that a ban on asbestos will negatively impact our nation's drinking water supply. This certainly catches people's attention, but again, it's not true. The chlor-alkali industry has known since at least 1989, again, 33 years ago, that a ban on asbestos was imminent, and they've been upgrading their plants, albeit slowly, with newer, more energy-efficient technology for making chlorine. When the revisions to TSCA were passed by Congress in 2016, the chlor-alkali industry had another warning that an asbestos ban was even more imminent. However, they responded by increasing their imports of asbestos in order to stockpile it in the event of a ban. Still, the industry is quietly changing to a non-asbestos technology that's more environmentally friendly, more energy efficient, and can produce chlorine for less money than using asbestos. In summary, I urge each of you to take the message back to your representatives and senators that a ban on asbestos in the United States is long overdue. We are a leading world economy, and we would like to think of ourselves as leaders on environmental issues, yet 70 other nations are out in front of the United States in eliminating asbestos. There's no known safe level of exposure to asbestos. We need to ban every fiber and every use.
Thank you, Brent. Our next speaker will be Greg Russell, and I think it's important for our staffers to know that ADAO has been working with the International Association of Firefighters since our very first conference in Washington, D.C. in 2005, which Dr. Castleman and others attended. So, Greg, it's an honor and it's a privilege to ask you to please share your thoughts and facts with the staffers.
Thank you, Linda. For background, I'd like to introduce myself. My name is Greg Russell, and I am a retired firefighter. I spent 33 years in uniform, and now I have the privilege of representing the 330,000 career firefighters serving in every congressional district in this nation. In fact, they protect 85% of America's population. So a little bit about me. As I said, I'm a retired firefighter. I have served on the front lines on an engine company, on an aerial company. I've worked in the fire marshal's office and been a fire arson investigator. And because of my exposure to toxins through the occupation, at age 37, I was diagnosed with prostate cancer. Prostate cancer is not one of those that is inherently linked to asbestos, but at age 37, I was suffering from an old man's type of cancer, and that is because of my occupational exposure. It is unrefuted that firefighters are exposed to toxins day in and day out, like asbestos, and because of that, we have an epidemic of cancer within the fire service. There are approximately 70% of our annual line of duty deaths. And by annual line of duty deaths, those are the numbers of firefighters that we have classified as dying in the line of duty through either traumatic injury or occupational exposures, occupational related health conditions. 70% of those that have died each year are dying because of occupational cancers. We have to arrest that number. We have to shrink that number. And by getting a handle on asbestos is an easy way for us to start that track. Let me be clear. My exposures, what I have on board, are on board. We can't do anything about that. My coworkers that are on the job right now, 330,000 firefighters that are out there. What they have on board, we can't do anything about it. But what we can do is take steps to prevent the next generation from experiencing those toxic exposures, and chiefly amongst those is asbestos. Now, what we do know is in 2013, NIOSH conducted a study and identified asbestos as a leading cause of firefighter deaths. And in fact, they identified firefighters had greater than 100% more likelihood of contracting asbestos-related diseases than the general public. Imagine that. Just because they work in an occupation, they are twice as likely to suffer from asbestos-related diseases. Recently, as recent as June of this year, the International Agency on Research of Cancer, which is a agency within the World Health Organization, designated firefighting, the first time they have designated an occupation, on the same level as known carcinogens. So by mere fact that you are a firefighter, you are in an occupation that is a known carcinogen. So it is without a doubt that firefighters are going to continue to die from cancer, but we can't accept that. We have to take bold action to prevent those deaths in firefighters. So what can we do? We can start by understanding that the legacy asbestos out there should be the limit. That's the maximum limit that should be out there. And we do this by halting future importations and use of asbestos that would then be released to the environment. Linda, I'm sure will speak on this in a few minutes, but the Port of Los Angeles is a major importation site for asbestos. Now imagine being a firefighter in Los Angeles County and Los Angeles City, where the bulk of our nation's asbestos importations travel through. If that's, doesn't put the hair on the back of your neck on end, then I don't know what would. That is high risk exposures. And imagine the population center in Los Angeles. So let me conclude real quick. I know time is short. The International Association of Firefighters is strongly 100% behind this effort to ban asbestos nationwide. Not just one fiber. We want all fibers banned, because we know once it makes it out into the population, into the houses and businesses across America, firefighters are going to get exposed. And let me back up just 1 second to tell you how firefighters are going to be exposed. Firefighters are exposed because all those yellow suits and black suits you see us wear, that protects us from thermal injury. It does not protect us from chemical or mineral exposures. So that asbestos lands on us, lands on our equipment, falls outside the structure on top of everybody working outside of a burning building. And then before the day's done, we take that back into our fire station where we begin to clean our vehicles, our equipment, our gear, and it gets reintroduced into the environment. Before you know it, we find it on top of our refrigerator, sitting on top of our beds. It's in our living quarters. We have to take bold steps now to protect firefighters in the next generation and the generations that follow. Thank you, Linda, for the time, and I turn it back to you.
Thank you, Greg. That's excellent. And thank you, Greg, and the IAFF for keeping us safe. Our next speaker is going to be Dr. Barry Castleman, who has traveled around the world so many times, raising awareness, working on prevention and policy. Barry, you're as an expert, I always lean on you for the chlor-alkali industry facts and stats. Can you share with our staffers how the chlor-alkali industry can transition and some of the basic information, please?
Yes. I'm a chemical and environmental engineer. I wrote my doctoral thesis on the public health and corporate history of asbestos. That's now been expanded to a 900-page book called Asbestos, Medical and Legal Aspects. And I testify as an expert witness in damage suits brought by various people against corporations that used and made asbestos products. As to the chlor-alkali industry, this is an industry that has there's only one plant using asbestos diaphragms in all of Europe still remaining, and it's phasing out soon. There's only one such plant in Canada. There hasn't been any in Japan for 15 or 20 years using asbestos diaphragms. This is a discredited hazardous technology, and all of the plants that use, the 9 plants that use asbestos diaphragms in the United States are between 40 and 123 years old. This is so antiquated technology, as has been mentioned, as Brent mentioned. It's actually not as efficient as more modern technology. This is an industry that uses a hell of a lot of electricity, and so energy efficiency is very important. And the non-asbestos diaphragms that have been introduced in recent years, not requiring total conversion of the process, but simply changing over of the diaphragm material, will pay for themselves in about 3 or 4 years, according to the manufacturing company. I visited their corporate headquarters in Milan 5 years and 6 years ago, and they gave me an extensive presentation on this. So this is an industry that's basically refusing to put up the fixed costs of conversion to the non-asbestos diaphragm material or conversion to the more modern membrane cell technology, which is all the chlorine plants in the world have used this. Everything built in the last 40 years or so has been membrane cell. So they got away from the mercury cell and the asbestos diaphragms with safer technology all over the world. So this is really, it's inexcusable that we have 9 plants left in the United States still running on this antiquated technology and using all of their political and other influence to oppose modernizing this technology. I also want to say something about imports. I've seen recent import data. Again, we've been saying to the Environmental Protection Agency they need to check out what's happening with some of these imports of asbestos products. Last year, we imported another 50 tons of asbestos yarn and thread from Mexico. We've been pleading with EPA for 6 years to go and find out what happens to that 50 to 100 tons a year of asbestos yarn and thread. What's it used in? What consumer products is it used in? What occupational exposures exist where the stuff is being used in the United States? What environmental pollution arises? We're still waiting for answers. Maybe some of you can press the EPA or the Commerce Department to provide with the import information so that the importer can be identified and these questions can be answered. We've also imported, continuing to import a few more tons of asbestos yarn, thread, cords, and string from China, asbestos cement building materials from China, brake linings and pads and gaskets from China and India. They haven't made brake linings and pads and gaskets with asbestos and for 20 years in the United States. But because the back door is open for these imports, these cheap imported products from countries where these products are made under barbaric conditions continue, and we are getting the blowback risk associated with the use of those products in our economy, which competes against safer substitute materials that are made in the United States. This is something that calls out for regulation, either through law or by the regulatory process at the EPA. We also imported another 41 tons of asbestos from Brazil. The only user of asbestos fiber left in the United States is the chlor-alkali industry. There are, for at least 5 years, there's been no asbestos product manufacturing going on in the United States anymore. So thank you very much.
Dr. Castleman, thank you. And to any of the staffers that have questions, when you hear the hogwash whining about water treatments will obviously be impacted by a ban. We look forward to having the staffers reach out to ADAO so we can give you the real information from Dr. Castleman and others. And Barry, I think it's fair to say what we do in the US matters, but what we don't do matters even more. Barry and I go to other countries, and because we have not banned asbestos in the US, other countries like Thailand and elsewhere will point to the US like, oh gosh, it must be safe. So don't be fooled by the industry's propaganda. Our next speaker is my dear friend and colleague, Bob Sussman, who has an amazing career. He's going to introduce himself, but Bob and I have worked closely together for 3 years. Bob, you are amazing. You have allowed us to achieve landmark steps forward, not only with our bill, but also legally with our lawsuits. So I'd like to introduce you to the staffers. Bob, take it away.
Yeah, thanks, Linda. Good to be here with all of you today. As Linda mentioned, I am a lawyer. I'm, in fact, a long-time environmental lawyer, working in the field now for over 3 decades. I spent 2 portions of my career at EPA, one in the Clinton administration, where I was the deputy administrator of the agency, and then again in the Obama administration, where I was the principal policy advisor to the administrator. And much of my work over the last several years has been supporting ADAO and spearheading the legal aspects of ADAO's push to ban asbestos, both providing representation and support in the courts and also backstopping Linda on the legislation. As I think you've gathered by now, the last 2 years have produced a whirlwind of activity on asbestos at EPA, in Congress, and in the courts. We are now in August of 2022 at an inflection point, and the actions that are pending will determine whether and how the U.S. steps up to the continuing threat of asbestos to public health. As you've heard from several of the speakers, although asbestos is banned in nearly all developed countries, the U.S. is a laggard and an outlier, and asbestos use and exposure continues in the United States, and that's a major public health concern and an urgent priority for regulators and policymakers, both in the Congress and at EPA. As I think you heard from Brent, EPA tried unsuccessfully to ban asbestos under TSCA in 1989. And despite years and years of efforts on its asbestos ban rule, the ban was tossed out by a court decision in 1991. And since that time, there has been limited regulation of asbestos use and importation at the federal level. You also heard that TSCA was amended in 2016, and the failure of the law to ban asbestos was in fact a poster child for the need to amend TSCA. And It was anticipated at that time that with the new authority EPA was getting, it would be able to complete the job that was started in 1989, and EPA immediately responded by selecting asbestos as one of the first 10 chemicals on which it would conduct risk evaluations and risk management rulemaking under the new law. Since 2016, over the last 6 years, I think it's fair to say that progress under TSCA has been uneven and at times rocky. But after, I think, a long struggle, we are now at 3 critical junctures with EPA. First, after completing its so-called Portland risk evaluation on chrysotile asbestos, EPA proposed in April of this year to ban 6 conditions of use of this asbestos fiber type. Of these, the most important is the importation of raw asbestos by the chlor-alkali industry, which, as you heard, uses asbestos in the production of chlorine and caustic soda. EPA made a finding in its Part 1 risk evaluation that the use of asbestos by this industry presents an unreasonable risk to health. And based on this finding, EPA proposed to phase out the use of chrysotile asbestos by this industry within 2 years of finalizing its rule. As I think you've also heard, rather than assisting EPA in this transition and working out the details of the phase-out process, the industry has mounted a pitched battle against EPA in an effort to establish that a ban on asbestos would have catastrophic economic consequences, and has warned specifically about effects on major sectors of the economy, including water treatment. And as a result of this, we don't know where the rule is going to wind up. We have pushed back hard on industry claims, and we've also emphasized, as Brent and Barry have emphasized, that the industry itself is abandoning the use of asbestos and investing in safer and more efficient alternate technologies. The second issue that is coming to the fore is legacy asbestos. And as Brent indicated, EPA initially refused to tackle legacy asbestos under TSCA, but its hand was forced by a court case in which ADAO was involved that established that EPA, in fact, had an obligation to address legacy risks under the law. Even after the court decision, EPA dragged its feet, and so ADAO sued EPA, and we were successful in negotiating with the agency a consent decree which requires it to complete its legacy evaluation by December of 2024. EPA late in 2021 issued a draft scoping document describing how would approach the evaluation of legacy asbestos, and ADAO with others submitted comments. The third significant aspect of EPA activity involves reporting on asbestos use and exposure. And I think many of you might be surprised to know that EPA embarked on the evaluation and risk management process for asbestos without actually requiring industry to report to the agency how asbestos was being used, in what volumes, and how many people were exposed. Because of that, there were significant information gaps in EPA's Part 1 evaluation. ADAO went to court, and we got a favorable court decision requiring EPA to issue an asbestos reporting rule. And EPA is in the process of doing exactly that. ADO is supportive of reporting. We submitted comments to EPA. We applauded EPA for what they had done, but we also said that EPA needed to do more. This finally brings me to the legislative arena, and you've heard a lot about that already. I just want to leave you with a couple of thoughts there. One, if you step back and look at the events of the last 5 or 6 years in asbestos, the struggle we have faced at EPA, the industry opposition we've confronted, and the limitations of the EPA Part 1 risk evaluation, it becomes clear that Congress can do what EPA has not done and maybe not do on its own, and that is to put in place a comprehensive asbestos ban that applies to all uses, applies to all 6 fibers, and sets clear and enforceable deadlines for eliminating asbestos, which cannot be delayed or challenged in court. So, yes, everything we've described at EPA is important, and we need to see it through and advocate for the best possible result. But frankly, the most effective solution to the threat of asbestos is legislation, and we need to get that done.
Thank you, Bob. That was excellent. So in closing, we do have Senator Merkley's 2 staffers on, and I want to thank his staff for tirelessly working on our ban. On the screen, you're going to see the AHERA definition that Brent referenced. And we had over 10 discussion drafts because we couldn't meet the needs of trade associations to how to define asbestos. To be clear, our ban is an amendment to TSCA. It will not impact and EPA doesn't have regulatory powers over FDA. So we need to work on stopping imports and use. As Greg succinctly said, the industry obviously has stockpiled. So can firefighters go into these plants and fight a fire, and will they know where the stockpiled asbestos is? I would say no. So it's time to stop trying to manage the risk of imports. As Dr. Frank and Flores talked about, over 40,000 Americans die every year of preventable diseases, and it's not just mesothelioma. You can see that lung cancer caused from asbestos exposure really leads the mortality rate on this slide. Clearly, Bob and Brent have discussed the EPA's Part 1, Part 2, and asbestos reporting. This slide has a lot of text on it, but the reality is EPA has found an unreasonable risk for chrysotile asbestos diaphragms and also sheet gaskets and brakes. And it's time to stop the imports and use. Clearly, Senator Merkley and Representative Bonamici's bill goes further, which is what we need. We want to push back on the industry, talking about how if there's a ban in place that we're going to have unclean water. It's nothing less than a disinformation campaign. You can see this slide. It was actually in the excellent EPA economic analysis that for water treatment, only 7% of industrial chlorine production and 5% of caustic soda production is used for water treatment. So it's time the journalists push back, the media push back, because it's nothing less than propaganda. Barry highlighted very well how this dinosaur technology of asbestos diaphragms has been reduced. ADAO is coming out with a new report soon. We have letters, and some of the journalists that we will speak to, we have letters from 2015 talking about how asbestos diaphragms accounted for 60% of production. That's just where we are now. It's less than 20%. So we know they can transition, and we know it's cost effective. The gift we got from the economic analysis was also what ADAO had been asking for over 12 years. Who is importing asbestos? Where is it being used? And we now know the 8 plants operated by 3 companies, the exact locations. ADAO is now planning an educational campaign starting with Louisiana just next week to reach out to these workers and their families to raise awareness about early warning symptoms, obviously, and treatment. This is a confusing issue, so I hope staffers can embrace an infographic. You have a lot of issues that you have to manage. We wanted to put the chlor-alkali facts down in one diagram where you can see the states importing and using, etc. I'm really disappointed that my state, as California, as Greg mentioned, California is leading the imports through Port of LA. So is Texas, Kansas, and Louisiana with imports and plants. Those 4 states should have had staffers, in my humble opinion, join this informational briefing so they could get back to their bosses. And lastly, we have huge thanks for Senator Merkley and Congresswoman Bonamici for their thanks in reintroducing. This is the 3rd iteration of the Alan Reinstein Ban Asbestos Now Act. There has been a hearing. Staffers will find a link to the EPW hearing on the staffer resource page. They'll also find a link to the 2019 House E&C hearing. So with that, I'd like to conclude the graphics part. We do have 2 journalists on, and Pat and Ev, I'll be honest, we now have Senator Merkley's staffers. So Caitlin or Serena, do you have any questions you'd like to ask to our panel? And they may be on mute. So if there are no questions in the Q&A, and I see that Ev and Pat, go ahead and pop off. We did allow 2 journalists to join us, and we are going to send this video to other news outlets. On behalf of ADAO, I want to thank the panelists, and please know that Dr. Flores and Dr. Frank had to pop off due to demanding medical needs. Dr. Flores had to go back into the ER. And I'm grateful to Greg and Brent and Bob and Barry and others for really bringing your education, your experience to the staffers to take what should be an easy solution to help them to understand that it is complicated, but they do have efforts. In closing, do any of our speakers want to end with anything that's being recorded? Brent, Bob, Barry, Greg? Let me ask Greg one question for the record. Greg, I read some information in a Inside the Beltway outlet talking about PFAS and how if the chlor-alkali industry did need to convert to non-asbestos technology, that would increase the PFAS, which we know they've already been converting. Can you give us your opinion on where you are with RBAN and transition and PFAS?
Sure. So from the International Association of Firefighters, our perspective is this: asbestos is a guaranteed known carcinogen that will kill firefighters. While PFAS is still a growing body of research to determine what the long-term impacts are. So at this point, we are more than happy to get 100% behind asbestos as a known carcinogen and then tackle the issues dealing with PFAS down the road, if in fact it becomes evident that, supported by scientific data, that there is a hazard by filter systems made from PFAS.
Thank you, Greg. I'm going to open this up, and I didn't realize that Serena wasn't able to speak, and she did post a question. So if anybody else wants to chime in, you're welcome to. If not, this concludes. Serena, did you want to ask your question? Any questions? So she was muted. Okay, well, we'll leave our discussions open for staffers' questions, and to all the panelists, thank you so much. And this concludes our 17th Congressional Staff Briefing. My thanks to all.
Thank you so much.
Bye-bye.
Thank you.
All right, Linda.